We've had a lot of questions regarding PRP injections in the shoulder and the elbow recently for our throwing athletes. So we want to talk about some of the things you might want to consider if you're an athlete that's dealing with some elbow pain or some shoulder pain. This is particularly true for the ulnar collateral ligament here on the inside of the elbow, because we're treating a lot more of these conservatively, where 20 years ago, a lot of these athletes went right into a Tommy John surgery. Today, we know that we can get a lot of these better without surgery, depending on where that tear is located and the severity of it, but also the symptoms of the athlete. So if you are one of those athletes that's got a grade 1 or a grade 2 sprain/tear, PRP may be a good option for you. Now, it's a costly procedure. Insurance isn't necessarily covering it at this point, and the research is kind of variable. You can look at some studies that show really positive effects and some that show it may not do a whole heck of a lot. We know it's not going to necessarily do anything bad to your elbow, so there's not a huge risk besides the minor risk of infection. It does take a little time. There is an inflammatory response that occurs whenever you stick a needle in something, but also when you inject something into the body. If you're dealing with elbow pain and you have a UCL tear, it may be a good idea to consider, especially if you're a higher level athlete. If you're a youth athlete, the research is definitely not there yet, but those athletes desiring to be professional athletes, I think that the research is definitely coming along and it bodes in your favor. So what is a PRP injection? Well, basically they take your blood, they spin it in a centrifuge really fast, and it's pulled out. You get that platelet-rich plasma, and there's different concentrations that your surgeon may use or your doctor may use depending upon what protocol they want to use and where they're injecting those platelets and that plasma. But ultimately what they do here is they're going to take that needle in, and wherever the tear is, they're going to stick that needle down to where that tear is, and then they're going to actually inject that PRP right into that area because it carries the nutrients that are going to allow it to heal, and not every place in the body has a great blood supply. So we know we have a better blood supply at the top area of this ligament versus the bottom area down towards the hand. And so a lot of times PRP is definitely indicated down for that bottom component of the ligament with a partial tear, but sometimes in that top portion, that proximal portion as well. If you're looking for the most comprehensive resource on training and rehabilitation of the throwing athlete, check out my book, Arm Alloy. The link is in the description. Now, back to the video. As far as PRP goes, we see some positive benefits from it. Our rehab protocol does change in the next couple weeks after, but it's nothing that's going to be slowing your progress to any substantial amount long term. It may be something that you consider, especially if your goal is to really heal this ligament up and get back to 100%. Now, once you get to that grade 3 full rupture, it's not going to do a heck of a lot. But at a lower grade 2 on the distal part, or even a mid to high grade 2 on that proximal portion of the ligament, or some mid substance where the middle of that ligament is worn down, it may be something that benefits you. So ultimately, it's a decision you have to make with your doctor. From our perspective as rehabilitation professionals, we've seen athletes here, even at our Farmington Hills location, because we just have so many elbow injuries that are coming into the clinic right now, that athletes with partial tears do well without and with PRP, as long as we address what needs to be addressed from the clinical physical therapy side of restoring range of motion, getting them strong where they need to be strong, but then also from the biomechanical side of analyzing how and when they apply load to their elbow, and then ultimately how we can correct that long term so you don't apply load in the same way you did that led to your injury. So that's kind of our synopsis on PRP. We've got a video we put up in the past of some of the exercises we do maybe in the couple weeks after. If you guys have other questions that I didn't answer here, drop them in the comments. And if you like this video, hit the thumbs up, subscribe to the channel, check out our website, overheadathletics.com. We'll see you guys in the next one.